A young child shows signs of social avoidance, restricted interests, fixating on a few toys or objects, isn't saying any words, is constipated, and has trouble sleeping. Lastly, the child has been banging his head or has serious meltdowns. The child is diagnosed with autism. Now what? What should parents do next? I'm Dr. Taketa-Wong. I'm a MAPS-trained physician, that's the Medical Academy of Pediatrics and Special Needs, with 14 years of clinical experience in successfully treating the medical causes of autism and changing the lives of autism families. When it comes to autism, there are many limitations inherent in the current approach. Parents are sometimes advised to put their child in behavioral therapy of some kind, but they have to figure out which one on their own. Many families are unaware of the medical problems that can cause behaviors common in autism because there hasn't been a medical diagnosis to go along with the autism finding. All right, once the diagnosis is made, what happens? Parents often feel confused, desperate, frustrated, and hopeless at the lack of answers from their pediatrician. They become stressed, exhausted, worn down. It can affect their marriage and the rest of the family. And there's so many questions and so few clear answers. I'm a big supporter of speech, behavioral, and occupational therapies and other therapies. There are also programs that address specific problems that autistic children have, like chewing and swallowing properly and responding to external stimuli, such as loud noises or bright lights. I want to be clear, all of these methods are important and helpful. At the same time, after dedicating my life to treating autism since I was a 10-year-old with a brother on the spectrum, what I found is that there actually is one key that unlocks successful treatment. There's one approach that is the foundation the others can rest on that makes them all more effective, and that one vibration. Because the body's physical and chemical imbalances are often the underlying cause behind autism and other spectrum disorders. There are answers, and children can get better. I see it all the time. Diagnosing and treating the medical conditions that give rise to autistic behavior can make a world of difference. There are 4 major areas of the body that commonly affect autism, areas where medical problems typically manifest. By treating these underlying conditions, children are able to improve over time, sometimes dramatically. The first area is the neurological system, which includes the brain and the nerves. The second is the digestive system, which includes the throat and esophagus, the stomach, small and large intestines. The third area is the immune system, which includes the lymph nodes, tonsils, spleen, white blood cells, and bone marrow. The fourth area is the metabolic system, which includes the liver, thyroid, adrenal glands, and the mitochondria, which power most of the body. I'm going to review each of these systems in a little bit more detail. Now, with the neurological system in the brain, there are several medical conditions that we commonly see: brain inflammation, seizures, and antibodies that attack the brain. These neurological conditions affect a child's language, awareness, learning ability, behavior, loud noises, strong light, sleep patterns, and even the taste of food. One of the most critical body that blocks vitamin B9, commonly called folate, from getting into the brain. Folate is critical for normal brain development and function. This condition is found in about 75% of children with autism. When we resolve this medical problem, we often see remarkable improvement in a child's behavior. The good news is that all of these conditions are treatable. For example, with seizures, which are uncontrolled electrical activity between brain cells, I've treated children who had aggressive or self-injurious behavior, like they're banging their head on the wall. Other young patients had periods where they are not responsive, where they're just staring off into space. While most people don't typically think of these types of behavior as the result of seizures, a child doesn't have to be falling and shaking on the ground to be affected by them. In fact, another sign of seizures is forgetfulness. Once the seizures are treated medically with an individualized healthy food plan, specialized vitamins, minerals, herbs, and medications, the associated behaviors typically improve, and sometimes dramatically. Now, moving on to the digestive system. The digestive system malfunction is often accompanied by aggressive and self-injurious behavior, meltdowns, or crying that comes out of nowhere. Often the child is suffering from constipation, which can magnify the intensity of their behaviors. They might also have inflammation in their intestines or stomach or acid reflux. In addition, there can be bacteria and parasites as well as food allergies or sensitivities. When digestive malfunctions are treated medically, a child's behavior often improves dramatically. Also, some of my young patients have had food allergies or sensitivities, and when we removed the foods that were causing them, their language improved and problems like meltdowns either diminished or went away completely. As you're viewing this and want to talk with me, just call or text our office to schedule a no-charge phone consultation. There is no charge because we don't take patients without talking to them first to make sure that what we do fits their needs. We are still taking new patients, and you'll find all the contact information on our Facebook page. And please remember to visit our online supplement store, which is on our website at drtaketa-wong.com. That's drtaketa-wong.com. Our prices are very competitive, and the proceeds go to helping children with special needs with their medical treatment. A link is in the post with this video. Now, moving on to the immune system. The immune system isn't strong enough. If the immune system is not strong enough, the result can manifest in frequent infections, whether bacterial, viral, yeast, fungal, or parasitic. There can be allergies where the immune system is attacking dust mites or foods instead of the person simply sneezing when it comes to pollen or dust. Also, foods shouldn't normally cause allergic reactions, but when the immune system is out of balance or it isn't functioning properly, that's what can happen. Allergies can develop. The areas where I tend to see recurrent infections are most commonly skin, digestive system, ears, throat, and sinuses in children with autism. In addition, there can be autoimmune disorders. This is where one's immune system is attacking their own body. It has been documented in research that many children with autism may be making antibodies that attack their own brain. I use natural remedies to strengthen the immune system so it functions as it's supposed to, which is to fight off the things that can make us sick. And as a child's immune system starts to function properly, their behavior also improves. The metabolic system includes, as I mentioned earlier, the liver, thyroid, adrenal glands, and the mitochondria, which power most of the cells in our body. With metabolic system dysfunction, the liver may be unable to clear toxins out of the body. There can also be thyroid or adrenal problems, which can cause either fatigue or overactivity or hyperactivity, depending on whether the hormone levels are too low or too high. Metabolic imbalances can also cause difficulties with mood, focus, attention, as well as abnormalities in blood pressure or heart rate. Research has found that metabolic dysfunction is common in autism and can explain many of the symptoms, including with the brain, muscles, and digestive system. I always use natural remedies as much as possible to heal the liver or thyroid or other metabolic system elements that are not functioning properly. Once those conditions are resolved, there is typically improvement with things like irritability and aggression, as well as with mood, attention, and focus. What's important to take away from our time together is that autism symptoms can be treated medically, typically resulting in happier, healthier kids and families. I'd certainly welcome the opportunity to discuss your family's specific situation so that you too can feel empowered with your health. To do so, just call or text our office to schedule a no-charge phone consultation with me. Please support also our online supplement store, which is on our website at drtaketa-wong.com. That's drtaketa-wong.com. Our prices are very competitive, and the proceeds go to helping children with special needs with their medical treatment. A link is in the post with this video. Mahalo, and I look forward to seeing you in 2 weeks. Aloha.